Right. When performing surgery for gynecomastia, it's most common to make an incision about half of the areola, specifically 180 degrees. If you make an incision along the lower half of the areola, it provides excellent visibility. This makes it much more convenient when removing glandular tissue or performing similar procedures. The scar is simply too large, don't you think? If the scar is that big, the areola's shape will become distorted later when the wound finally heals. This happens because the incision line is just too extensive. Furthermore, if the incision is large, nerves that emerge from the outer area will also be severed. Your sensation also gets worse. The smaller the scar, the better. So when you hit your watch at the 6 o'clock position, you make a single precise hole with a knife right there. Then it's about 4 to 5 millimeters. No matter how large it may be, it will not exceed approximately 7 millimeters. Consequently, with a small incision, there's hardly any visible scarring. Also, the nerves are not damaged. We conduct the surgery in a manner that minimizes damage to the surrounding tissues. In particular, when performing breast cancer surgery, many blood vessels can be damaged. Gynecomastia is a condition. It is not breast cancer. The idea of trying to remove 100% of the glandular tissue stems from breast cancer surgeons who know that leaving behind cancer cells can be a serious issue. Consequently, surgeons who have experience with breast cancer operations often remove too much tissue, even when performing gynecomastia surgery. When blood vessels are cut, a lot of blood comes out, right? So a long tube, what we call a drainage tube, is inserted to allow the blood to flow out. Many people even consider this to be a common standard procedure, and there are also many hospitals that introduce it that way. Actually, that's not the case. Why? If we minimize damage to surrounding tissue through a small incision and avoid causing any blood vessel damage, then we don't necessarily need to use a drain. So how do we manage the blood from accumulating? No, not at all. We make sure there's no bleeding. Because there's almost no bleeding, we don't need to use a drainage tube. No drainage tube is used, and there's absolutely no damage to the surrounding tissues. This means the surgery is incredibly clean and precise, so you can go directly back to your accommodation immediately after the procedure. If there's bleeding or damage, you'd naturally be hospitalized and observed overnight. However, with surgery at Silhouette Plastic Surgery, there's minimal damage, no vessel injury. So you can go home right after surgery, you can eat, sightsee, and look around. Silhouette Plastic Surgery operates using the most advanced methods.